Hello, good afternoon from Geneva. Good morning and good evening, everyone who's joining us from all around the world. Welcome to another Ask WHO Social Media Live Q&A session. My name is Uva and Uec. I work in the Department of Communications at WHO headquarters. Well, the first day of summer just arrived in the Northern Hemisphere 2 days ago, and we share some tips across our social media platforms on how to protect yourself from overexposure to UV radiation from the sun, including the newly launched mobile application that we will talk more about it as we go along. And what else could be better than having a WHO scientist specializing in radiation and health joining us today to give you some useful tips to enjoy your summer safely, answer your questions, and of course, debunk some common myths, which is my most favorite. And it is my great pleasure to have with us today Emily Van Deventer from the Department of Environment, Climate Change, and Health at WHO. Welcome, Emily.
Yeah, right. So my name is Emily Van Deventer, and I'm the head of the radiation unit in headquarters in Geneva.
All right, Emily, to kick off our conversation, the first question for you this afternoon is, what is UV radiation, and what are the factors that can lead us to exposure or overexposure to UV radiation?
Well, UV radiation is energy, usually from the sun, but you can also have UV radiation from artificial sources, the man-made sources. For example, in medicine, you use certain lamps that provide UV radiation to treat diseases or jaundice, for example. You also have lamps in industry. You use UV radiation for disinfection. So in the recent past with COVID, they have been using some UVC lamps. And then for cosmetic purposes, such as sunbeds, they use UV radiation. So this ultraviolet radiation, it's a bit tricky because you cannot see it, you cannot feel it. It's different from light that you can see. For example, from the sun, you see the light coming through to Earth, so you know there is this radiation. For infrared radiation, you feel it because you can feel the heat of it, but UV radiation you cannot feel it nor see it.
How can one be exposed to UV radiation, Emily?
Well, actually, anytime you go outdoors, you will be exposed to UV radiation. So the exposure is very dependent on the time of day, on the season, also on the duration of your exposure, how long you're out, and also on your location. So for the time of day, of course, if you go out in the middle of the day, let's say from 10 a.m. to 4 p.m., you usually have to be careful if it's the summer months. And the time of year, of course, the season is important, but also your location. So if you are at a latitude close to the equator, then you will have higher UV radiation levels. If you are high in the mountains, high in latitude, the UV levels will increase. You have thinner air there, and so you will have higher UV. Also, it depends on the cloud cover. So if you have a cloudless sky, then you will have higher UV. But having clouds around doesn't mean that you won't have any UV. It doesn't block the UV. So you have to be careful even if you have a cloudy sky. And then you also have reflections. So some people don't think about it, but when the UV comes down to Earth, it can reflect off snow, it can reflect off the water, and even the grass, and that increases your exposure to UV radiation.
Thank you very much, Emily, for a clear explanation. Before I get back to you with more questions, Emily, I would like to welcome our amazing fans and viewers who are joining us from all corners of the world. Today's topic is about UV radiation and health, and how to enjoy your summer day safely away from overexposure to UV rays. To ask your question, on Facebook and on LinkedIn, just simply leave your question in the comment section. We have a whole team working behind the scene and curating your questions for us. So, Emily, when it comes to UV rays, we often hear about the UV index. Could you tell us more about that? What is the UV index for? What does it tell us exactly?
Yeah, so the UV index, sometimes you will see it through the media or on an app, or as called UVI, is the acronym. And it's very much an information tool that describes the level of solar UV radiation at the surface of the Earth. This tool was developed by WHO, the World Health Organization, together with the World Meteorological Organization and the United Nations Environmental Program, as well as the International Commission on Non-Ionizing Radiation Protection. And this was developed over 30 years ago and tweaked over 20 years ago now. And it is an indicator of the potential for skin damage. So the higher the UVI value is, the greater the potential for damage to the skin and to the eye, and the less time it takes for harm to occur to you. So if you have an UV index that is low, that means that you don't need to do much to protect yourself. The higher it gets, the more protection should be implemented.
So what would be the safe zone? Which level for
Yeah,
us?
yeah. So for a fair-skinned person, you should implement some sun protection measures when the UVI reaches 3 and above.
Okay, cool. Thank you, Emily. That's super interesting. And all right, I saw some questions started coming in. Before we take the first one, I'd like to ask this question, a very important question for this afternoon. So, Emily, what are the pros and the cons of exposure to UV radiation?
Well, that's a very good question, because it's not a straightforward yes or no question. There are benefits from being in the sun, and there's also some harms from a health point of view. So in terms of benefits, when you go outdoors, you will have vitamin D built up, made in your body. And this small amount of UV radiation are very beneficial to your health, and actually are key for your bone and musculoskeletal system. So it prevents diseases such as rickets. So people who have very low sun exposure, like people who are, let's say, in hospital or in prison, or people also who have very pigmented skins and live in high latitudes, or people who cover their body when they are outdoors for cultural or religious reasons, they would need to consider oral vitamin D supplementation. So this is important, to have some UV exposure, or at least some vitamin D. But the excessive exposure to UV really is associated with a number of harmful health consequences. And these harmful consequences are really on the skin, in the eyes, and also on the immune system.
Thank you, Emily. And for those who just joined us today, we're talking about UV radiation and health. If you have any questions about UV radiation, please send those questions in the comment sections on Facebook or LinkedIn. So I'm seeing the first question here. A viewer who's watching us asking, what is the difference between UVA, UVB, and UVC?
Very good question. That means that you already know quite a bit about UV radiation, if you know about this division of the UV spectrum into these three regions. So the UVA part of the spectrum is where you have the lowest frequency. That means the longer wavelengths. And this is actually the most common UV rays that you will find from the sun, and also the most dangerous, because the UVA can penetrate in the skin down to the middle layer of your skin. The UVB has a shorter wavelength and therefore can only penetrate the skin on the top layer. And some of these rays are actually stopped by the atmosphere and by the ozone layer. And it can also be stopped by glass, for example. And then you have UVC, which usually on the Earth's surface we don't get because it is completely stopped by the ozone layer. But the only exposure you can get on UVC is from artificial sources, so such as lasers or welding torches in industry.
Thank you, Emily. So we have a follow-up questions from one of our viewers on LinkedIn, Kelechi. He's just asking, or she's just asking, how is the UV index measured? Maybe you mentioned that already here and there, but could you please tell us one more time, how is the UV index measured?
Yeah, so the UV index is actually measured by meteorological organizations around the world, and they are either measuring the UV index or forecasting the UV index. So these are organizations that have the measurement equipment or the computer facilities and the models to provide this UV index.
Awesome, thanks. All right, I have one last question before we moving on to the debunking some myths session. So this question is from a viewer from LinkedIn. Could you tell us about the impact of climate change and sun exposure? Where's the link?
Yeah, that's a very good question, and there is quite a bit of research being done on this, but as you can imagine, it's still not clear. But climate change, including variations of the ozone layer and also about cloud cover, is expected to impact UV radiation levels at the Earth's surface. But at this point, we cannot really tell what that will do to us or what that is already doing to us. But there are models that are being developed to try to answer this very question.
And Paul Doloroca, who is watching on LinkedIn, also asked, are the amounts of UV radiation have increased in the last few years?
Yeah, this is a good question. It depends where you are on the globe. And also it depends on the ozone layer where you are located. So in general terms, we have data going back a number of decades, but recent data have not been put together to answer this question. I mean, very recent data.
All right. Thank you very much, Emily, for your answer. Before we move forward and take some more questions from the audience, I have a list of common myths and misunderstandings for you to help us debunk today. So what I need you to do is to respond to this statement that I'm going to read it out with a yes or a no, and give us maybe a short explanation why. Does it sound good to you? All right,
Yeah.
here we go. What do you say, Emily, if someone tells you that there's no need to worry about UV rays when it's cloudy outside?
That's a good question, and I actually already answered it in a way.
Yeah.
Of course, UV levels are highest when there's no cloud. But even with a cloud cover, UV levels can be very high. Actually, 90% of UV can penetrate a cloud.
All right. Awesome. Thanks. So the next one is Sunbed's use offers protection against sunburn. Is that true or false?
This is false. Another myth, really, because a tan that is produced by a sunbed actually provides very little protection against sunburn and solar-induced DNA damage. So, in fact, research shows that a sunbed does not reduce the risk of sunburn, and may even increase it, because you have the false sense of protection. So this is really not true.
All right. Maybe perhaps you could tell us who should never ever use a sunbed.
People with fair skin definitely should not use sunbeds. Young people, children, there is actually a very strong data about people up to, not even children, but up to age 35, that you increase your risk of developing skin cancer every time you go into a sunbed.
All right. Next up, what do you say if someone tells you having dark skin protects you from cancer?
Ah, Well, darker skins do burn less than fair skin, but they can still develop cancers. And actually, even though the incidence of skin cancer is lower in dark skinned people, the cancers are often detected at a later stage and therefore at a more dangerous stage. So, in terms of the skin, it's partially true, but they can still develop skin cancers. But regardless of your skin color, the risk of eye damage and the harmless effect on the immune system are the same regardless of your skin type.
All right. So the last one, I think this one is very interesting. There is a myth, a misunderstanding about skin cancer. It's not that serious and it's easy to treat. Is it true or false?
Well, skin cancer can kill. It can be deadly. And we have every year over 120,000 skin cancer related death, premature death from melanoma, but also from non melanoma skin cancers. So we have 1.5 million new cases of skin cancers per year. So this is definitely a myth.
All right. Thank you very much. Very useful information. Just a reminder for all of you who just joined us again, our program today is on UV radiation and health. We have Emily, a scientist specializing on radiation and health, to answer your question with us. You can send over your questions or anything you wanted to share with us in the comment section if you're watching on Facebook or LinkedIn. Before we take a couple more questions, I think now our viewers may want to know how they can protect themselves from overexposure to UV radiation. You have any tips, any advice?
Yeah, so maybe I scared you about UV radiation with discussing the different negative health consequences. But the good news is that these health harms are preventable. And what are measures that you can take this summer? Well, you can limit your time outdoors in the middle of the day. You can seek shade when the UV rays are most intense. And mostly you can wear protective clothing. That means clothes, but also hat, a broad hat, and sunglasses, usually sunglasses that are wrap around so the UV rays won't come on the sides. And you can also use broad spectrum sunscreen to protect your body.
All right. And we just launched an application. It's called Sunsmart Global UV App. Perhaps you could talk a little bit more about that application.
Yeah, so a couple of days ago, we launched a new app that provides localized information on the UV levels. So you can just put in your location wherever you are, and then the app will provide you with a 5-day UV and weather forecast. And it will also highlight the time slots in the day when you should put some sun protection measures in place. It's available free of charge, and you can find it in the Apple app and the Google Play stores.
Yes, everyone, it's now available. The application, it's called Sunsmart Global UV App. We will put a link in the comment section so that you can click and download it for free. Um, Emily's, here are quite a few questions coming in now. I'm seeing here one of the questions. What kind of sunscreen should I use?
Yeah, so sunscreen, you should try to use a sunscreen that is broad spectrum, meaning that it will block both the UVA and the UVB rays. And as you know, sunscreens come in different with different SPF factor, skin protection factors. So the higher the SPF, the more protection the sunscreen gives you. But the thing is, with sunscreen, it is only one of the measures that we recommend. And we have done quite a bit of research on sunscreens, and we noted that people very often don't put enough sunscreen compared to the directions on the bottle and don't reapply often enough. So these are very important points, that a sunscreen is only as good as how much you put and how often you reapply.
All right, and I saw some questions from our viewers on LinkedIn about people with different type of skin tone. The amount of sunscreen that we use, is it the same amount of sunscreen, or if we have darker skin or lighter skin, the amount of sunscreen we use, it's different or it's the same?
Yeah, well, as I said, sunscreen is just one of the means. I think putting long sleeve clothing is the first protection to use. But in terms of skin type and sunscreen, obviously for fair skin people, they will have to use more sunscreen and hopefully higher SPF. Darker skin tend to burn less, as I mentioned earlier. Yeah.
All right. Here's another question from one of our viewers on LinkedIn again, Christina. She's asking, hello, how much is enough or how much is safe sun exposure per day?
Uh-huh. So as we discussed, having some sun exposure during the day is good and even important. But depending where you are, it can be from 5 to 15 minutes is enough to give you the amount of vitamin D that you require. Above and beyond this, you will have to protect yourself.
All right. So I'm seeing another question from Rafa Omer. He or she is asking, is there any specific requirements for the sunglasses to protect us from harmful UV rays?
Yes, that's also another very good point, because sunglasses have to have UV protection. If you just have dark plastic lenses, it actually may be more dangerous than not having sunglasses. So definitely invest in good sunglasses that have UV protection.
All right. One of the questions I received here from a public health researcher, uh, he or she asks, as a public health researcher, I have a question. What's the process to resolve the UV protection in hospital area?
UV protection in hospital.
Yes.
I'm not sure I get that question, if it's related to.
To perhaps to people working in hospital exposed to radiation while using equipments.
So that would be another part of the radiation spectrum. That may be discussing ionizing radiation. I'm not quite sure about that question. But definitely for ionizing radiation, workers and patients have to be protected.
Right. All right. So, well, a lot of people asking about sun exposure during the day. So I have one last question from Harold Perez, from watching from Facebook. So perhaps I know you already mentioned here and there, but perhaps we could reiterate one more time. What's the recommended time to stay out for sunshine?
So to actually build up the right amount of vitamin D, you can stay in the sun between 5 and 15 minutes, and the amount of UV radiation that you will get through your hands, your face, your neck will be enough from a vitamin D point of view.
Right. And I think I have another interesting question before we close our conversation today, from Wiki Jones. Does applying sunscreen block vitamin D?
That's a good question, and it's true that it protects you from the UV rays. But usually, when you put sunscreen, you will be in the sun for more than 5 to 15 minutes. So you should be able to get both your vitamin D and your protection in that case.
Awesome.
But just I want to, if the question doesn't come up, I do want to mention that
Yes.
children are at particular risk from UV radiation because their skin is thinner and their eye is actually more transparent to UV radiation. And so, even though you may not see a big acute effect of exposure when you're a kid, if you have had quite a few sunburns, you have a much higher likelihood of skin cancer in later age. So be careful about children and protect them.
All right. So I think I will take this one last question from Mark H. Marcus, watching us on Facebook as well. What type of clothes can protect us from UV rays?
Well, that's a good question too. We've talked about SPF for sunscreen. There is also a UPF, another factor for fabrics. And in Australia, they have developed a number of fabrics that have different UPFs. So depending on the fabric, how it's made, you will have different levels of protection from UV radiation. So you can look at the UPF online, and there are some specific fabrics. I don't know, when my kids were young, I used to check these things before they went to the beach.
All right. Thank you, Emily, for your answer. I think we covered pretty much some of the most important questions, and we are running out of time now. Before we close our Q&A session today, perhaps you could tell us more about WHO works or WHO role and response to protect people around the world from radiation. Any work in progress, any activities coming up from
Yeah,
WHO?
yeah. So from a WHO perspective, what we do is we work to advise national authorities on the effects of radiation and also on protection of the public, but also of the workers and the patients. And so we develop tools like the UV index, or in this case, this app that we just launched a couple of days ago. We also develop research agendas to push the research forward from a public health perspective on the topic of UV radiation.
Thank you very much, Emily. All right. If you want to learn more about WHO's key areas of work and activities in the subject of radiation and health, please visit our website, www.who.int. And don't forget to download our Sunsmart Global UV app that could help protect you from overexposure to UV radiation during the summer. It's free and available now on App Store and Google Play. And thank you everyone for tuning in from all over the world, from India, Bangladesh, Kenya, Cameroon, Brazil, Mexico, and many others. Thank you for sending in your questions and sending in your thoughts. And thank you, Emily, for joining us today. And last but not least, everyone, if you liked our Q&A session, give us a thumbs up or share it if you loved it. Do go follow, if you haven't already, on our social media platforms for upcoming and exciting activities from the World Health Organization. Thank you, and until next time. Bye bye.
Bye.